Parents often ask one big question: does my child need medication? And behind that question, there's much more. Sometimes there's the fears, the guilt, and the hope that my child can thrive. Today, we're not here to give prescriptions. We're here to talk about the bigger picture, what it really means to care for the whole child. Joining us here is Maite Rabotata, a clinical psychologist in private practice, who will help us unpack how medication can sometimes be one piece of the puzzle, but never the whole story. We'll explore how to balance the emotional, the psychological, and the developmental needs of your child. We'll talk about when medication might come up, how families and professionals work together in that decision, and most importantly, how to release the stigma and focus on what truly supports your child's growth and happiness. Because at the end of the day, it isn't about choosing medication or not. It's seeing the full picture. It's understanding your child deeply and making choices with clarity and compassion. Maite, some of the things that parents ask, or some of the concerns that parents sometimes have: if my child take medication, will they still be the same, or will they change? Will they be somebody else? What do you say to a parent like that?
Well, thank you so much for having me on the show. It's such an exciting thing to be part of such a movement, a show that addresses questions that a lot of people are out there sitting with and have no answers to. So getting straight to your question, the reason why often parents will become hesitant, or sometimes even they will shy away from allowing their children to take medication, it's the lack of understanding that we still have with regards to what exactly is medication there for. So if you really look at it, we often would associate medication with conditions, or maybe sometimes when we're looking at people who have physical conditions, so to say. But when it comes to mental conditions, we often shy away from that because of the negative connotation that medication has when associated with such things. So your question is, will my child still be the same if my child is to take medication? And so 100%, the medication will be there to assist the child to be able to be more of themselves, and so that the child can be separated from the condition. So the thing that the medication is going to address, it's not the child, but what the medication addresses is the condition itself.
Absolutely. I just love the way you put it. It's so insightful, and actually it brings a little bit of a relief to hear you say that as an expert. That is so powerful, Maite. I like the way you unpacked it. It makes it so understandable to everyday parent to understand and grasp. Do you have a moment or a story that you can share where you saw a parent's transition from a position of fear to feeling relieved and empowered?
Well, there's actually a lot of stories that I can, refer to. And this is because it's very common for a lot of parents who come to see us, who, it's common for parents to be apprehensive when it comes to medication. So there have been cases where parents will come in, and obviously the kind of help that they're looking for specifically from a psychologist is for their child to be helped through talk therapy and other means of therapy. But what they're not looking for, or what they're not hoping to get, is to say, now your child will have to be put on medication. So when that topic comes up, where obviously I'll have to refer the parent to a psychiatrist, a lot of parents tend to be very apprehensive. And so you could see the fear immediately, once that is brought up. And so it is during that time that we take the opportunities as clinical psychologists to then educate parents and to help address those fears, but helping them understand, the effectiveness of medication, but more than that, the importance of medication. And once they're able to grasp that understanding, a lot of parents, obviously, because at the end of the day, what they want is for their children to be well. So you can clearly see them starting to be more receptive, to the medication, because they have a clear understanding. Whatever concerns that they have had, they had the opportunity to have those concerns addressed.
Interesting. So it's actually lack of understanding and lack of knowledge that brings about fear. We fear what we don't know. We fear what we don't understand.
Yes.
So in your consultation room, you lay those fears to rest through education. That's amazing. Shoot, interesting. Mate, what do you think is beneath the fear of the word medication? When parents hear it, already alarm goes on. What is behind the fear, in your view?
Okay, so I'm going to take us back a little bit, to when medication started, and especially when it comes to mental health conditions. So when medications first started, because there was still newness in understanding, mental health conditions, and also newness in trying to find what was effective and appropriate in terms of medication. They were the medications that were administered then had a lot of side effects. So the fear usually started from there, because when we were still starting off, we had to do a lot of research in order for us to understand the condition so well that we minimize the side effects and be able to, have the person get the benefit of the medication without them potentially being harmed by the medication. So we have progressed since then to a point where now we actually even have several types of medication that are suitable for specific people with specific conditions with minimal side effects. So now I would say, answering your question is that underneath the fear that parents have, it is still that ideology, that was previously held about medication, and the fact that, a lot of people in some cases will appear to be worse, than how they had been before being put on medication. So we have definitely progressed from that.
And that's what in the mind of the parents when they're hearing the word medication.
Yes.
It's very nice to hear, Maite, that there's been progression, there's been an advancement, there's been a lot of learning, which is why fear, we should try and eliminate fear as a result. Very nicely said. So you often talk about the importance of the whole child, like nurturing the whole child. Can you unpack for us what that concept is about when we look at medication?
So when we look at medication, medication plays an important part, because if we are going to address a mental health condition, for instance, there's a part where we have to do, like in my case, there's parts where we have to do psychotherapy, and there's parts where we have to also include the medication. So the two work hand in hand together to increase the prognosis of the condition. So when we talk about, looking at the whole child, when we're talking about what is holistic, it's where we are integrating, what I do as a clinical psychologist, that is providing psychotherapy, and also me being complemented by a psychiatrist who will then prescribe medication to enhance, the possibility or to increase the probability of this child to be able to function.
I love that phrase, the whole child. It's something positive about it. Okay, can you share with us, Maite, a story where you saw a child thrive, that's the word I'm looking for, where you saw a child thrive and kind of live within their strengths?
As you're asking that question, a story that immediately came to mind is actually a personal story. So I have my daughter who is 17 years old. She, a couple of months ago, had been diagnosed with ADD, that is attention deficit disorder. And so for the longest time, she had struggled, and we weren't quite, we couldn't quite pinpoint what exactly was the problem. Because even with her, it was very difficult for her to articulate what, the challenges that she was experiencing. But through, me engaging with her and trying to find out where her struggles were, because predominantly her struggles were with her performance at school. And so she was then...
This is before the diagnosis.
So this was before the diagnosis. So then she then went and consulted with a psychiatrist, and that's when she received her diagnosis, and also then was put on medication. So it was a huge shift from how she felt about school, from, before she was on medication and after she was on medication. Things that she struggled with, that she wasn't aware that it was part of the condition, were now addressed, and she was able to perform, just as other kids who do not have the condition. So the thing with mental health conditions is it's very difficult sometimes for children to get diagnosed, and also sometimes for mothers to be able to pick up these conditions. And largely it's because some of the symptoms of the condition, they are often taken as normal behaviors. Like when a child in school, when they often daydream, they often think, well, parents, if they're seeing a child's performance because they daydream and they can't focus at school, they're thinking it's because the child is not being serious. When a child struggles with being able to retain information, with being able to comprehend, parents would often think it's because the child doesn't, put in the necessary, effort. Exactly. So you could see that, from the child now being diagnosed and having these things addressed. So even if the child might have some areas of struggling, but you start to see the progression of this child now moving away from being influenced by the conditions to a large degree, to now being able to function like other children.
That's a powerful story, Maite. It's so empowering, hearing the positive impact of having just a medical support for your child. And it must have been such a relief for her also to know that, because generally in our schools, children are labeled. They're being called, you're not smart enough, all sorts of negative labels, which is not good, right? But it's nice for you guys to finally find a diagnosis, but also which means if you have a diagnosis, you can get help.
That is true.
Yeah. So you have been through the process. I mean, it's quite recent, and you actually are the best person to be speaking to the parents at home, who, especially that parent who's feeling like, I'm losing sight of my child. With all these labels, all these diagnoses, what can you say to that parent?
So again, it's very important for us as parents to separate the diagnosis from the child. It can be a difficult thing for us to do, and hence it is important for us to look for people who are professionals in such areas. Also finding your own psychologist. There's a parent of a child who has a mental health condition. It's actually most of the time, recommended, because it is there that you will be able to be educated and also be able to deal with your own feelings about, what you have thought your child to be and what actually your child is. And so that helps us to be able to embrace the child despite our children being diagnosed. So we don't become overly consumed by the condition, because we are able to see the condition as a separate identity from who our children.
Oh, that is so powerful, and it's often difficult from my experience of having engaged with parents, with some parents, that it can be difficult to go past the grieving process, and it is at that moment where everything just feels so gloomy. But it's so reassuring hearing you say, it's empowering to differentiate, right? To separate your child from the diagnosis. And this question in particular makes me think of some of the learners that we have had the privilege of working with, who are on Ritalin, for example. And sometimes parents will ask, do you guys asking the coaches, would you mind if my child doesn't take medication today? Because they're taking so much and I'm worried that they're becoming overly reliant on it. But not only that, my child is totally different when they're on medication. And some of the expressions that we get to hear sadly is that my child is not the same as my happy, energetic child that I know after they've taken medication. You know, they're very different. What do you say to that parent who say, I just want my child back?
So, and I can definitely sympathize with parents because most of the time you have known your child, you know, when it comes to mental health conditions, you have known your child with the condition to a point where as a parent, it's even difficult for you to know which part of your child is your child and which part is the condition. So the example that you brought up, it's a very good example because parents who have children who have ADHD, for instance, because of the condition, the child tends to be energetic. But that is not the child's personality. That is the child's condition. That is the condition of the child. And so you have to look at it in terms of also what it comes with. When a child is overly energetic and when your child is extremely busy, that is just some aspects of the condition. So other parts that affect this child is that this child will struggle with concentration, is that this child will struggle with focus, that this child will easily be distracted. And so all of that also needs to be addressed. So yes, you're going to start to know your child in a different lens. But you see, that's the lens in which your child is supposed to function in. So as your child, as you've known your child as this energetic child, largely the energy behind the energy was the condition.
A child trying to regulate themselves even, right? A child trying to communicate even. So powerful, my dear. Thank you for unpacking that for us. Now, some parents who are listening now may be wondering, in your work, my dear, what are the psychological and the developmental factors that parents should be looking out for even before they consider medication?
So that usually is addressed in the therapy room, because what we would often do is when you bring your child to see a clinical psychologist, we would either do assessments on your child. And so those assessments will assess the child's psychological, state, where we will assess the child's emotional state, the child's cognition, the child's social skills, and other aspect of, the child's functioning. And so from then on, we can be able to identify parts of your child's functioning, that is part of your child's psychological functioning that is affected by the condition. And it is then that we then would advise and say, based on the child's age, based on how your child is functioning, we see that maybe their attention is compromised, for instance. We see that their memory is compromised, for instance. And it is then that we would then advise for the child to be seen by a psychiatrist, who will then, after doing their assessment and their evaluation, will then say, yes, medication in this case, it's warranted.
So that's something that gets done in the experts room, essentially. But that doesn't necessarily limit the parents from doing their own observations and maybe even the teachers at school. What would you say, what will that look like, those observations, those developmental and psychological factors? What will they look like in a school environment or in a classroom for a teacher or at home for a parent?
So what often happens, with teachers is they do, like a simple example, for instance, we know that, children of a certain age are supposed to be able to sit in the classroom and focus and listen to the teacher and follow instructions and so forth. Now, teachers have been taught to be able to pick these things up, where you would clearly see that this child is struggling, at the age that they are at, to sit down and focus and, follow instruction. They easily get distracted. They fidget quite a lot. They get up and they're disruptive also in class. So those are the typical signs that teachers will be able to pick up. And this obviously also speaks to parents as well. Mothers, fathers, they always know when the child when there's possibly something wrong with the child, even if they might not have the vocabulary, to say, I think this is what is wrong with my child. But just getting that sense of just feeling like, I think maybe something might be wrong, that is good enough for you to take a step further and to consult with professionals, to get that confirmation.
Yeah, sure. Very insightful here. Very insightful information. And what would you say to a mom who's listening to this and they feel like, I'm at the end of it all, and they feel like they're at the end of the rope? What would you say to them?
So
but they've tried everything they can, as far as supporting the child is concerned, a neurodivergent child for that matter. What would you say to that parent?
Okay, so this will take us back to what was already addressed, is to say, when you have a child who's neurodivergent, it's not only the child that needs help, it's also the parent that will need to be supported. And so if a parent gets to a point where he or she feels like, I'm at the end of my ends, I don't know what else to do. I feel like I've tried so much. Either if emotionally, the parent is emotionally exhausted, or the parent is just at a point where they don't know how to fully support their child, whatever it may be, parents also can find their own, help.
Their own professional support.
Their own professional help. So that, again, it's an indication that shows that you are not in a good space. And therefore, it is encouraged for you to make that step to say, okay, let me also reach out, because it's not something that one has to deal with alone.
Yeah, I like the way you put it, Maite, because often as moms or as parents, we keep going, right? Until the cup is completely empty. For a parent with a child on the spectrum, that makes you inefficient to support the child. So as you say, they should seek help. Interesting. Yeah, so we're now going to talk about collaboration, because nothing ever happens in isolation. How do you, as a clinical psychologist, collaborate with other professionals like pediatrician, other maybe even educational psychologists, to make sure that the child is being supported from every angle?
I've touched on quite a bit on psychiatrists, and I think because obviously our focus was on the medication, so that is one of the collaborations that I would do, as a clinical psychologist. So everything related to medication, I've got my colleagues who are psychiatrists who are better suited, to address that. But then it's not only with psychiatrists that I collaborate with. I also work with occupational therapists. I also work with educational therapists in order for the child to, again, get a holistic treatment. So with occupational therapists, for instance, their focus will be on assisting the child to be able to do, your day-to-day, activities, to be able to function. You look at educational psychologists as well, who are going to help with the child with the main focus on helping them to be able to function when it comes to their academics and so forth. So, like you said, it is never supposed to be in isolation. So once you consult one health professional, then that professional will then make the relevant referrals to other professionals who are going to form part of providing this child with a holistic approach.
So I like how you are unpacking, what each professional, each expert does to support the child from every angle. But I can't help but think of the parent at home who's, they feel overwhelmed with this multitude of experts that are all coming at different angles. Have you dealt with that? And how do you help parents find their voice in that context?
So remember, with the professional, we are all behind the parent. So the professionals are never to be ahead of the parent. They are not there to replace the parent, but they are there to support the parent. So even how it is done, the approach is the same from each professional. The first thing that we do is to ensure that the mother or the father gets the support that they need, so that with whatever it is that we are also introducing to the child, we know that this child will benefit more from having well-supported parents. Yes. So actually what often happens is the opposite. You will find that parents are overwhelmed before they start working with the professionals. But once they start working with the professional, then it's not something that they're taking on alone. So now they're having a team of people who are backing them up and helping them in ensuring that their children function at their best,
Wow, it
their
takes
best
a village.
ability.
The African,
Yes,
all-wise African proverb.
100%.
And it makes sense, as you say, and it's interesting how you put it, that it's usually the other way around. Don't do it alone as a parent. Get that village of professionals. And we know that it's not always easy for everybody to get these professionals. Are they accessible in the public health system, or is it all available for people who can afford?
So we do, fortunately, our public system has, made means to be able to, provide those services to people. So in your public hospitals, you will find your occupational therapist, you will find your psychiatrist, you find your psychologist, you find, all those professionals, you are able to find them there. Also in certain public schools, you can find educational psychologists, but where that is not the case, you can ask the people at the school, the teachers, to link you up with educational psychologists or other professionals who work for the government sector.
Okay, go ahead. I don't want to interrupt you because from some of the parents maybe that we engage with, this professional support can feel inaccessible, and sometimes either because of the costs or the proximity to where they live. It's nice to hear you saying the support in the hospitals. There's also support in the school, in the school that they can access.
Yes. Yeah. I think more than anything, what we need to do to push forward is their awareness. When people have information that empowers them. So I do, yes, that is true. Back in the days, it was difficult. In some areas, to be really honest, it's still the case, where you might find that people, in certain villages or in townships, you find that, the services that are provided there, it's not the same as in urban areas. So I'm definitely not overlooking the fact that there are parents out there who are struggling because, yes, accessibility is a problem. And there are parents out there who are struggling because, yes, finances are a problem. And so that's something that also needs to be addressed without it being overlooked or us just assuming that everybody is on the same, the same playing field when it comes to that.
Thank you for pointing that out, because I'm hoping policymakers are listening. Because as I've mentioned, we have had the privilege, my colleagues and I, to talk to parents that are kind of afflicted by this particular situation. Because it makes a huge difference. A child or a parent with a 360-degree support with the one that doesn't have.
Yes.
You see, so I'm happy that you touched on that. So just staying on the topic of collaboration, what does a perfect collaboration looks like? Can you paint us a picture?
Well, a perfect collaboration will depend on what the child presents with. And every child obviously is unique. Even though you may have 3 children who are diagnosed with ADHD, those 3 children will not necessarily have the presentation of the condition in the same way. So it will start with either if the parent takes the child to an occupational therapist, or the parent takes the child to a psychologist, and the psychologist will do the assessment and make the relevant referral based on the findings that they found. So a perfect one would be what is suitable for each child's uniqueness and their presentation of the condition.
This is very educational, yes, people can go to Google and try and Google all this information, but why should you, when we have experts that are sharing so generously? what the process could look like, what a good collaboration could look like. Thank you for touching on that. So we're now going to look at knowing when to ask for help. Some of us, we don't always know, and I think parents more so on moms. You know, we often, I think naturally, we tend to, because we're naturals, naturally, we tend to take on the load and we keep going, as I've mentioned earlier, until we've run flat, right? What should parents be looking for in terms of the signs to start considering medical intervention?
Okay, so I think we did touch on it a little bit, but we can touch on it again. And that is, when it comes to medication, parents will not necessarily know. So with medication, it will only be the psychiatrist who can make the assessment and say, okay, the child needs the medication. Because reason why this won't be easy for parents to pick up is there are assessments that needs to be done before we can come to the decision, you know, that this child will benefit, you know, from medication. The same is if a child comes and see a psychologist, there will be assessments that are made, and then we look. Sometimes there are other interventions that we put in place before going to the medication, but it's always, you know, case dependent.
Absolutely.
So it will differ from one case to the next. But what I can say to parents is to say, whenever you get a sense that maybe something might not be right with your child, do consult. You lose nothing through you finding out that actually the child is okay. It's okay for you to go consult with the psychiatrist and say, you know, just check my child. Consult with the psychologist and just check my child. I just want to ensure that my child, you know, is doing well. We do that when it comes to our physical health, where I can go and just have a physical examination just to ensure that everything is still intact. So why shouldn't we do that when it comes to also our mental health? It is okay for us to do that as well.
Absolutely, sure. We have to look at mental health as something really important, because without our mind functioning properly, we cannot exist. We cannot function, essentially. Are you able, Maida, to just give us maybe a glimpse into what you know, what factors might be presented maybe in an ADHD child or an autism child who, in your experience, eventually ended up needing a medical intervention?
So usually with medical intervention, we look at the severity of the condition on the child and the extent in which the condition affects the child's functioning. So hence, again, going back to the individual case. So if it's a child who's struggling with ADHD, yes, there are certain things that we can do with his behavioral modification, which does not necessarily entail medication. Like, for instance, ensuring that where the child, you know, if the child has to study, for example, ensuring that there are less distractions where the child studies, ensuring that it isn't very noisy where the child studies, creating structure so that the child then is able to follow structure so that they don't become disorderly. So those are the things that we can put in place. However, coupled with that, there are certain symptoms that would need medication, like the child's ability to concentrate. Now, concentration can be enhanced by us, you know, how can I say?
Changing the environment,
Changing the environment. However, it will be enhanced to a point depending on the severity of the condition on the child. So ideally, we consider all factors and we are then advised by how a child functions. So if we can start by, you know, altering the environment and the child starts to thrive, then therefore there might not be a need for medication.
So if I'm hearing you properly, are you saying medication might be a last option in some instances? The last option that is being considered if all the other factors have been addressed?
Yes, that is absolutely correct. So medication can be the last option that is considered. Medication might be the first option that is considered. So again, the professional, as they are presented with the child, it will be because these are, you know, an area that they work in and an area of their expertise. They can able to tell sometimes even after just first examination with the child to say this child will benefit highly from medication. And again, again, when we think about medication, it's not something that I wouldn't say that when a child doesn't need medication, then that means, your child is more advantaged, like their situation is advantageous than a child who needs medication. It's not that at all. It's just that when we're looking for interventions, we always want the intervention to be appropriate with the presented case.
Absolutely.
Yes.
Sure. That is so insightful, and listening to you, because you literally work in the journey with your daughter, and you've seen the power of medication. And I like how you're making, I like how Maite is making a distinction between the perception around medication. Those that are not taking are not necessarily better or more advantageous. It's just the case that is being presented before us. This is really, really nice this is very insightful. And I almost can hear a parent whispering, that sounds like my child, right? And I'm likely also hearing you saying, go consult, right? Go consult with the experts.
Yes,
don't make, as we said in the beginning, this is not about prescriptions, right? It's about getting expert advice on what to do, what to consider, in fact, under different circumstances. Let's take a moment to reflect on what we've covered today. Medication is not the enemy, nor is it the full solution we had. Parents don't need to carry any guilt whatsoever. The key is seeing the whole child, not just the diagnosis, and making choices with clarity and compassion. Maite, if you could sit with every parent right now, what message would you like to leave with them as a clinical psychologist?
Well, I think, when you were just speaking now, you said it so well, to say, it's important for us to understand that, mental health conditions are part of human existence. These are human experiences. And so we do not need to fear them. As you said, when we empower ourselves with knowledge, that helps us to not be so fearful of things. So it is in that therapy room that you will be empowered with knowledge, you will be empowered with understanding, so that this doesn't become something that you fear. And it is even then that, what you touched on is that it is even there where you will be able to not have to handle this on your own. You don't have to be isolated in trying to figure it out on your own. So it is absolute, there is help out there. It is available for you to reach out and receive it. And so you're only encouraged to do so.
Very well put. I'm a little bit sad that this has come to an end now, but I do know that Kirsten and the team have a plan to have you back to talk about community, the power of the community. I don't know what else they'll be inviting you as we approach the holiday season. So we will be so honored to have you again. Yeah, so I'm so happy that we're here, Maite. One of the things that I really appreciate about you is the fact that you make time in your very busy schedule to connect with the parents here. And one thing I haven't mentioned, Maite is one of our contributors quarterly to our Celebrating Neurodiversity event. So she comes here and empower other parents on key strategies they can use to support their children to thrive, particularly children that are neurodivergent. But I also know, Maite, one of the things that you do really well is to run workshops, but also to educate the public about your area of expertise, particularly mental health. How do people connect with you? How do they book your time to engage and lead or run masterclasses around this topic?
Thank you so much, Emma, for that. So people are more than welcome to connect with me on LinkedIn. I'm also on social media. I'm on YouTube and also found on TikTok.
Well done. That was awesome. Well, this does it for us at Beyond the Box. If you found this episode insightful and you believe it could help someone you know, please do share with them, like and subscribe. From my heart to yours, until next time, Abiyonto.